Hi, do you have an autism spectrum child, and have you been wanting to explain the diagnosis to them? So I see a lot of parents who are in this situation, and either their child has just recently been diagnosed and they want to explain it, right at the time of the diagnosis, or I see a number of situations where the child was diagnosed when they were quite a bit younger, and it's now the point when the parent feels that this is the right time to try to explain to the child what the name of the diagnosis is and what that means. So I've developed a strategy that I use that I want to share with you to see if it will work for you. Now, this is specifically for children who have some form of high-functioning autism or Asperger's syndrome. So that means that they're able to understand language. I'm usually using it with kids who are able to read. So we're talking about, kids who are maybe age 6 and up who have a good use of language and average to above average intellectual abilities. So what I've done is that I created a jigsaw puzzle. Now, I do think the actual whole concept of the jigsaw puzzle with autism is a little bit overused, but in this case I think it works. And the reason I think it works is that we know that kids and teens on the autism spectrum are better at details than the big picture. So I want to be able to explain what an autism spectrum means in a way that they're going to be able to best understand it. And that's by using different details so that they can see how it applies to them. And one of the things we know about the autism spectrum is that trying to understand the diagnosis is really confusing for adults. So professionals don't agree that much on it. There's a lot of controversy on the diagnosis being changed to use other criteria. A person can go in for an evaluation and one person can diagnose them as Asperger's syndrome, one person can call it autism, someone else might say this person isn't even on the autism spectrum. So there's a lot of confusion about what it all means even amongst adults. So we take a diagnosis that's confusing and then we try and explain it to a child who's very literal and concrete and detail-oriented, so it can be pretty difficult to explain it. So I like to have a very concrete and detail-oriented strategy that takes into account some of that complexity. And really what that complexity is that you may have a list of quite a number of different symptoms of autism and only some of them apply to the particular child in question. And another thing that's confusing for kids is they have sometimes met or know of someone who has autism or Asperger's, and what they notice is that that child is very different from them. They don't notice some of the similarities, they notice the differences, and so then they're really confused. What you're saying, I have autism and I know, this other person who has autism and they're very different from me. And even that even happens amongst adults. Adults might think, no, my child can't have autism. I know a child with autism and they're completely different from my child. And one thing that I sometimes explain to adults, is that just because someone has depression, it doesn't mean that they're just the same as another person with depression. There are a lot of different qualities to them, but they do have a few things in common, like that they're sad a lot, or that they're tired, or that their concentration is poor. And then all these other qualities about them are very different, one from another. Well, with an autism spectrum disorder, there's certain characteristics that people with autism, who have an autism spectrum disorder may have in common, but they have all these other aspects of who they are that are different. So it's important for people to realize that it doesn't define all of who someone is. The other thing that I like to emphasize when I'm talking to children and adolescents about the autism spectrum is that it often means too that they share a certain set of strengths. So I talk to them about how something has been figured out about them. It's often been through some testing. So I say some testing has been done and something has been figured out about how your brain works, and that your brain works in a way that's a little different from the way some other people's brains work. But there are other people whose brains work that same way as yours. And it's called having autism or having an autism spectrum disorder, or sometimes I use the word Asperger's syndrome. I'll often just, in the way I talk about it, call it autism or Asperger's, something like that, because they may hear both terms being used. And so I'll kind of keep repeating that. And I'll say, you know, we've found that your brain works in this way, and your brain is hardwired to work in that way. You were born this way. It's something that maybe has been known about you since this point, or maybe that just found out. We didn't know that this was true, but your brain was working this way ever since you were born, or, you know, ever since you were very little. You know, if someone knows maybe the child was developing normally for a year or so and then had some regression, and so you're wanting to be accurate. You might say, you know, at a certain point your brain just started to work a little bit differently, and that's called having autism or Asperger's. And then you have these certain strengths, and you have some things that are harder for you than other people. So what I want to do then, this is what I'll say, is to go through with you what some of those strengths and weaknesses are for people who are on the autism spectrum, and we're going to see which ones are true about you. Now, I usually do this with the child or adolescent and with their family, because sometimes the child will know that certain things are true about them, and then other things they might be like, oh, I'm not sure if that's true, and the parents will be chiming in, oh yeah, that's true about you, and they might be able to help the child understand how that concept applies to them. All right, so I just want to show you this for a moment. You won't be able to read the details on it, but I just downloaded from the internet a printout of a jigsaw puzzle format. And then I wrote in a number of different qualities of people on the autism spectrum, both things that one might consider strengths and weaknesses, so that I would be able to go through it and be pointing to each one. I go through each one with the kids, and oftentimes I'll have them have a copy of it and a highlighter, and I'll be having them color in the things that are true about them. Or sometimes, if it seems better, I'm just having them hold a copy and I have my own copy and I'm coloring it in as a parent or the child identifies that that's something that's true about them. So that we're starting to then put a picture together of what the autism spectrum disorder looks like for them. So you might have 10 kids and their puzzles might have different pieces colored in. But usually what they see is at the end of our discussion, a lot of the pieces are colored in. Now, I also point out to them that if we took any person and asked them about these different qualities, which I'll go through in a moment, everyone would probably have at least a few of them. So it's not that, say, neurotypical people, as we might call them, don't have any of these qualities. They usually do. But someone on the autism spectrum has more of them. And it's a strategy that's worked well for me, and I also find that kids don't find it so distressing as other ways of talking about the diagnosis, because really what they do is go, oh yeah, that's true about me, yeah, that's true, oh yeah, that one's true too. But then they also, on some others, they might go, no, not that one. You know, so they seem to really relate to this strategy of doing it. So I'm going to read a few of them out to you. But also what I'll do in my written description of the video, I will provide the list that I use on my jigsaw puzzle form in case you wanted to use something similar to that, and you could make your own. So some of the ones that I've used are things like, I'll read across the first line, poor eye contact, intense interests. Now some of these, depending on the age of the child, I might describe in more detail. So intense interests, I might say, well, that means that you have something that you're really into, or you know everything about it, you know, something like that. So not all kids would know what that word intense means, but usually once I start to describe something you really know a lot about, and generally speaking, I know the child, so I might be able to say what it is. Like it might be Pokemon or dinosaurs or snails or whatever it is that that particular child is really into. I'll say another one is, the next one is difficulty with writing essays or creative writing. Now that applies to kids that are maybe a little bit older in elementary school who are starting to do things like that, and they might know that they have those troubles, or even kids in junior high and high school. I might not use that exact one if it was a really much younger child. I have another one that says lack of motivation if it's not your special interest. Now again, depending on the age of that child, that might take quite a bit of explanation. So I might say if it's not the thing you're really interested in, like dinosaurs, then a lot of times you just really don't want to do it. You know, so if it's something that, you know, if you need to pick up your room or things like that, you know, and it's And if it's something that doesn't have anything to do with dinosaurs, you really don't want to do it more so than other kids, because, you know, most kids don't want to pick up their room, but it's not quite as difficult for them. So again, that's the kind of thing that takes a little more explanation, especially for a younger child. Another one is honest. Again, this doesn't apply to all kids on the autism spectrum, but some kids on the autism spectrum are really at the point where they just almost can't lie. They're so truthful. But I describe it in the very positive terms about what that means. Another one is that they might have been slow learning to talk, and that's often where the parent will chime in. They might say, oh yeah, you know, you were slow learning to talk, you know, and by the time you were 4, or maybe by the time you're 5, you were talking really well, or maybe even by 3, after you had some speech therapy, but you might have been slow learning to talk. Now, just as a little technical caveat, that usually means they've probably been diagnosed as being with autism as opposed to Asperger's, because usually you won't have an Asperger's syndrome diagnosis if you were slow in learning to talk, but that's more of a technicality. Another one that I have is not imaginative. Now again, I have to usually explain that one, because some kids on the autism spectrum have a good imagination. Others don't, but they don't realize that because maybe they imitate and act out a lot of different things from movies that they've seen or from video games, and they're really into particular characters from games. But when you look at it closely, you'd find out that they really weren't creating imaginary worlds of their own. They're only using a pre-established fantasy world that every detail is already set up for them. So again, that takes some explanation. I'm talking about what that's about. The next one is difficulty with the back and forth of conversations. So I might say, and that's usually something parents will comment on, but sometimes kids will comment on that too, that they're not very good at one person taking a turn talking and the next person, then the other person talking, and then them taking a turn and then the other person talking. So what I do is go through each of the things on the jigsaw puzzle, which, as I said, I will list the ones that I use on the video description, the written video description, so if you want to reference that, you can. I go through each one of those things and have the child indicate and the parents indicate which ones are true, so that we end up with a jigsaw puzzle that's been colored in by the end of our discussion. And I would say, because it takes some time to explain each one and what it means, and to have sometimes some discussion back and forth with the child and the parents about whether it's true about them, I would say the whole overall discussion takes, you know, anywhere from a half an hour to an hour. You know, because I usually start out with that description that I gave at first about some of those hardwired differences that have always been true about the child, but we now just have a name for it. We didn't have a name for it before, but now we do. And that there's some ways that they have some things in common with other people that have this diagnosis, and we're going to figure out what those things are. And I also want to, you know, by the end of it, have, you know, ended on some positive note about some of the strengths that that child has, and, you know, maybe taken something, for instance, I've got one that says very good with facts and details, and have really sort of positively reinforced that for the child, and maybe noted some ways that that's very true about them, and what a special quality that is, and how other people count on them to know certain things about that area of interest, so that they have some overall positive view of it by the end of our conversation. And then I also have something that they can take away with them that sort of indicates to them, okay, this is sort of what this means about me. And I want them to be able to have that to where maybe they could talk with family members about it. So I think this is something that parents could do with a child, or another therapist, you know, could be doing that same kind of thing with a child who's been recently diagnosed or recently come to understand that that is something that's true about them. And one of the things I want to comment too is on how children tend to react to the diagnosis. I've had this discussion with probably hundreds of kids, and it's most commonly, I would say, done for me with children who are elementary age or junior high age, and occasionally high school. And the most common reaction has just been kind of like, oh, okay, and then just moving on. So parents who, especially parents who are not on the autism spectrum, are often very concerned about it because they may have a stigma in their mind that they have internalized about what it means to have autism or what it means to have Asperger's. And so they are experiencing some pain and grieving about what that means to them. And they're concerned that their child, may have internalized that same stigma, which occasionally is true. So I can't say that that's never happened. I've sometimes seen some kids who have a negative idea about what that means about them, and they experience some sort of temporary loss of self-esteem as they sort of work through what it means to have been given that diagnosis. But the vast majority of kids that I have seen who have recently been diagnosed with this have been, I would say, almost a little indifferent. Sometimes slightly curious, but by the end of it, it's like, oh, okay. And they rarely have many questions. The parents are often saying, okay, well, we'll come back next time and we'll see if you've got any questions and we can talk about it more. We bring it back up with the kids and they're just like, oh, no, I don't have any questions. They're not that interested in it. They're not as concerned as someone who's neurotypical about what other people think of them. And sometimes it's frankly a relief because they now have a way to describe something that they have known for a while that's been different about them. Now again, I can't say that's true for everyone, but that's been true for the majority of kids that I've had this discussion with. So my name is Barbara Lester. I'm a licensed clinical social worker. I have almost 30 years of experience of working with children and adolescents, and I specialize in working with families affected by autism spectrum disorders. If you're interested in these kinds of videos, please subscribe to my YouTube channel, which is ASD Specialist. And thanks for stopping by.